Welcome back, scholars, to another AME facilitated session. I am Dr. Darren Wayne Jackson II, your co-host and moderator, joined by Dr. David Leon Taylor.
Welcome back, everyone.
Yes, sir, our expert facilitator, CEO of AME, and also co-host. So, DT, we're going to start today's facilitated session, and we will give the title. It's called The MCAT Maze, Navigating the MCAT Maze. And in today's session, we'll break down some of the key structures of the MCAT exam, some essential learning and thinking skills that go into taking the MCAT exam, and then how to culminate all of this into a strategic plan. So we're going to talk about structure, skills, and then strategy in order to be a success on the MCAT. What do you think about that?
DJ, is going to be critical because a lot of our scholars, unfortunately, are led to believe from some, of course, the online media, social media sites, etc., it's a myth that this exam is only a content exam. This exam is much more than content. It requires us to actually think like a future doctor, to connect important information with a meaningful purpose. And if we don't understand the actual structure of the exam and those thinking skills, and then create an actual plan that aligns with that area, then we're not going to be able to optimize our preparation, let alone our MCAT score.
So you mean to tell me memorizing an Anki deck won't give me the 520 plus on the MCAT?
It's not going to do it. All that is going to be medical trivia. And this exam is not a medical trivia exam where can I recite the key facts? I have to be able to think through this information and actually solve problems. So today we're going to kind of lay the foundation for what is this exam all about? How is it structured? And what are the skills that I need to actually practice so I can be successful?
So let's go into that talk. So let's set the table. DT, what is the real purpose of the structure of the MCAT? What is the MCAT actually trying to assess in the students that's taking it?
So it's focused on, are our scholars able to use the non-science as well as science? Let me say that again. The non-science as well as science information that they've mastered through their undergraduate curricula to actually solve problems in medicine. This exam, the purpose is not to weed out who can go to medical school versus who cannot go to medical school. The purpose is to evaluate scholars' ability to take non-science as well as science information and use it to solve problems in medicine. And we see the exam is structured in a way where there are 3 science sections that have us focused on that science information and problem solving for medicine. But there's also 1 non-science section that has nothing to do with biochemistry or physiology or general chemistry or physics, but maybe with the humanities, the arts, music, Celtic civilization. And how in the world is that related to medicine? Most importantly, our thinking skills for problem solving in medicine.
So let's create that a very targeted list of those 4 sections of the MCAT. Since we're on the structure part of the MCAT exam, what are the 4 structures? What are the 4 topics on the MCAT that it's testing?
So let's run the list, as we say in medicine. So the first section on the MCAT, and this is the order in which the sections appear, is the chemical and physical foundations of biological systems. The chemical and physical foundations of biological systems. And I want our scholars to note, I said the full name of the section. I did not say chem phys. And that's going to be important because we're going to connect this understanding of chemistry and physics to some biological system. And we'll be discussing an exemplar to bring that home a little bit later. The second section is our only non-science section, and that is the critical analysis and reasoning skills section. Again, CARS. Has nothing to do with driving,
No.
but has a lot to do with navigating problem solving using critical thinking and reasoning skills for medicine. The third section is the biological and biochemical foundations of living systems. Now, that living system for us is the mammalian system. And again, we're going to connect biology and biochemistry to the entire body. So if we simply say biochem, which we commonly hear, there's no connection to the entire mammalian system, and we're going to be evaluating how the problems in biology and biochemistry affect the entire body. The last section is the psychological, social, and biological foundations of behavior. Again,
Psych-soc.
we hear psych-soc, but let's do it again. Psychological, social, and biological foundations of behavior, suggesting there are 3 dimensions to human behavior. And as we think about those 3 dimensions to human behavior that may be expressed, again, how do we problem solve in medicine related to those 3 areas? So simply first understanding the specific structure in terms of the names and what those names represent in terms of connection back to medicine, which is the purpose, is one of our first starting points in the blueprint for success.
So as a quick recap, we have 3 science-based sections on the exam, and then we have what some might call a curveball, which is a non-science, where the student is giving a non-science-based passage or vignette, and they're asked to extrapolate information from that based off of this non-biological system. What information, and this is a skill that's particularly important for a future doctor to hone in on, because we'll talk about later about why this makes sense in terms of getting a passage on art history or Celtic history or anything like that. What is the examinee, what is the exam maker tending to get from us pre-med students from this information? So DT, let's run some exemplars. So let's start with our first section, which is
the chemical and physical foundations.
I was prompted to say chem phys. I'll get it down soon.
That's right. That's right. As all of our scholars will too. Right. So you remember Ohm's law, right? What's Ohm's law?
Ohm's law, which is V, voltage, equals IR, so current and times resistance.
Exactly.
I was struggling there a little bit.
Exactly. That's right. You're on the hot spot. You're on the hot spot. All your scholars are watching too. Right. So V equals IR. So pretty much we could ask all of our scholars Ohm's law and they would give us that response.
Right.
The challenge is that the MCAT is going to require you to do a lot more than simply recite the law, or if you're given some calculations to do, right, then to plug it into the formula and then give an answer.
Which you would call popcorn
questions. Yeah. Exactly.
Level one.
That's level one. Yeah. Popcorn questions, right? So, yeah, we may see 1 or 2 questions like that, but let's explore what we're likely going to receive as relates to Ohm's law. Okay, so this law looks at the movement of ions across a biological membrane. When ions move, they create current, right? All right. And by the way, these ions, like what, sodium, potassium, chloride, all of those. Hey, that was like general chemistry, right? In the periodic table, remember that?
Yeah.
Okay, so now I got general chemistry and physics together. Oh, chem phys. But I haven't connected it to a biological system yet. That's why it's chemical and physical foundations of biological systems. And that's connecting to a biological system, let's say the heart. So I have a cardiac cell, and now with this cardiac cell, we can look at the movement of those ions across that biological membrane. Those ions, when they move, they're going to encounter resistance. But when they move, we know eventually with that current, we eventually create a process called membrane potentials. And that electrical activity is the foundation of how the heart beats and ultimately how we'll have contraction of the heart, which links to the purpose of providing blood supply to the entire body. Well, let's say we go in and we disrupt one of those ions, their movement. That could disrupt the electrical activity, which could disrupt how the heart beats and therefore disrupt how the heart contracts. Well, when we disrupt the rhythm of the heart, that's called an arrhythmia. And that's where the MCAT is going. Are we able to take the core science in this section that we learned,
which is chemistry and physics,
and can we connect that understanding to a biological system? The heart is part of the cardiovascular system for a meaningful purpose related to medicine.
So this is the reason why memorizing an Anki deck doesn't do you much favor, especially if it's your primary, course of action for scoring well on the MCAT, because we don't want memorization. We want the integration. So if you're talking about a chemistry and physical context within a biological systems, we used Ohm's law, which talks about current and ions. So we're talking about ions from the periodic table, moving. We have charge movement across a cellular membrane. Then we have to look at the context of depolarization, repolarization, refractory period, right? And when we add a disruption to that system, how does it cause the pathology, which is the arrhythmia? So all of these various different things from the chemistry and the physics context, creating this sequelae, so to speak, that leads us to this arrhythmic, pathology. And so that's the reason why you always stress that memorization is should never be your primary go-to in terms of a strategy for the MCAT, because you have to critically be able to think about all these interchanging concepts rooted in biological systems.
That's right.
Yeah.
And it has to be part of your actual study process. And I always like to say, if I knew you're going to ask me a question a certain way, wouldn't I study that way?
Right.
And what I find very interesting is that our scholars a lot of times are encountering these more integrated questions. And what's happening sometimes is they're saying, I don't understand how to answer this question. I know it's about Ohm's law, but I don't understand how to answer the question, because they're not asking you a popcorn question of Ohm's law. They're asking you to apply your understanding. And therefore, until we understand that blueprint, we are not studying that way. And unfortunately, we'll keep asking ourselves what's happening. Unfortunately, we'll keep doing practice questions or practice exams and not reaching our optimal score, even, and I won't mention any prep programs, but even when we pay $5,000 to $8,000 for any of the prep programs on the market, those programs may not be teaching me how to think. They are reviewing core information, but I have to know how to
manipulate that information in my mind.
That's right.
And so, that was a good example, the Ohm's law, for the chemistry and physics foundations within biological systems. So let me go through the next three sections and give quick exemplars for each one. So I'm going to need your help.
Yes.
Because as maybe some of our other future doctors, I may not have the full names down right now because, we did the abbreviation. So for the bio and biochem.
Yes, which is known as the biological and biochemical foundations of living systems.
Okay. So in this section, we'll think about something such as, let's say, glycolysis, right?
Everyone's favorite topic,
glycolysis. I just can remember back to the actual FS sessions back in Georgetown and LA4, LA2. What is the rate limiting step? What are the substrates? Right. What are the this? What are the that? Yeah, so it's bringing back some memories. But let's talk about a PFK1 enzyme deficiency, right? We need to look at that in terms of how does this disrupt energy production within every cell. But then generally, how does that look from a pathology standpoint for the entire mammalian system?
That's correct, because it's connecting now biological and biochemical. So we know, of course, glycolysis is biochemistry, but that's happening within various biological cells that have certain biological functions. And if the energy is not present to drive the biological function
Right.
across the entire body, now our valued patient is saying, I don't seem to have energy or I feel fatigued. Now, here's the interesting part. We're using an exemplar with glycolysis. There are many, many reasons why a patient might feel fatigued
Exactly.
or feel like they have a lack of energy or they can't accomplish something. So that is the full integration of all of our science concepts and understanding, because as a physician, you are a medical detective. But staying with this particular example, that would be, again, a way that the MCAT connects a core concept such as glycolysis to the entire purpose of what you're called to do in medicine, which is what's its relationship. And the requirement, as you said, that we have to not only understand glycolysis and different enzymes, etc., but then connect it back to the system. What happens if there's a disruption in the process? Again, will there be a question that says, which of the following describes glycolysis? Absolutely. Great. Check. I get it right. Which of the following is the committed step in glycolysis, or what enzyme is associated with that?
Popcorn.
Great. Check. I'll
Number
get
one.
that. But that's not the vast majority of questions. For every 10 questions, 2 out of 10 are like that. The other 8 are going to be like what we're describing.
Yes.
So that's a losing battle if I can only get 2 out of 10
Right.
across the whole exam. Every 10 questions, I'm only getting 2 out of 10. That's not going to work.
You got to be strategic. So that brings us to the second section, and you will help me out, but I think I got it. Psychological and social foundations of behavior.
As I always say to my scholars, that was very reasonable. Very reasonable.
Almost.
However, it is the psychological, social, and biological foundations of behavior. And DJ,
Got that biological.
That's right.
Biological.
That's correct. And DJ, we're having some fun with this because, again, we're trying to be authentic. One of my roles is to be, watch this, reasonably expert in these areas. Every now and then, I need to go back as well. Any expert always goes back and reviews and updates so they can model with reasonable accuracy for scholars, right? And so we're modeling the fact you're already a physician.
Right.
You've already been through this.
Right.
And you're like, well, this is part of the process why we have mentorship and mastery, because you bring the journeyed experience. I bring the educational teaching experience, coaching experience. And that means that I'm supposed to kind of know all these names.
Right.
You don't have to know all the names, but you certainly understood it, because there's no way you could be a physician without having gone through the MCAT to go to medical school.
Exactly.
So I just want to underscore for our scholars, it takes work. It takes work to actually master the blueprint. And many scholars underestimate that. Some scholars just want to look at that and say, oh, that was wonderful. In our process, if you want to really grow your score, we actually have scholars who are in the blueprint, learn the blueprint for 30 days. You learn the blueprint for 30 days. And then once you can demonstrate mastery of the blueprint, we know you are ready to actually set an MCAT study plan that will always incorporate the blueprint. So you're always thinking the right way in preparation for the exam. Otherwise, what are we doing?
But now you've graduated into being able to incorporate the content material
Yes.
into it. And so just to go back, so I can have my refresher, the psychological, social, and biological foundations of behavior. Is that correct?
100% correct.
Okay. So for an exemplar for this one, let's use depression, right?
All right.
So depression can have an internal factor, which is maybe what we call an organic psychological or psychiatric issue. So an internal physiological issue. So this may be a neurotransmitter deficiency or some type of hormonal imbalance. But there can also be external factors to depression that we have to be able to extrapolate from our history, our HPI, such as social issues, isolation, social determinants of health. So all of these things can be drivers of depression that the MCAT is looking to tease out from these various. We'll get into the thinking skills in our next section, but this is all the various different things we have to consider and why you continue to drive home the importance of understanding the naming. So the psychological, social, and biological. We talked about the internal, the two
Yes.
internal, which is the psychological and physiological. That's the psychological and biological in the name.
Yes.
And then the social part can be those social determinants of health, the isolation as drivers to the depression.
Absolutely right on point. And I was imagining you studying as a scholar for the MCAT, and that's the process you want to
framing.
go through, the framing you want to be using and saying, oh, well, this particular behavior, only one of those play a role, one of those dimensions, right? Maybe it's the psychological dimension, the internal emotions, or some organic issue, right? In another situation, it might be two of the dimensions. Maybe it's the biological, there's some chemical deficit within the body, but there's also some social situation that's creating isolation if we follow our depression exemplar. So that is the process, as you said, that you want to be practicing.
And understanding that framework allows us to confidently dissect that vignette, that passage in that manner. Because if I'm looking for a psychological or organic issue, maybe within the vignette, I'm looking for some details that clue me into a genetic disorder, something. If we're talking bipolar or some type of psychotic, situation, maybe this has been found in other family members, right? If we're talking about something that's from a physiological standpoint, well, what labs, what objective data do I have in the vignette that is supporting this being a biological issue? And then from a social determinants issue, those things are placed within the vignette that can maybe give us some type of hint that maybe the driving force for this depression is that, or this particular question is asking us to extrapolate the social aspects or elements of depression, but there still may be the biological and organic psychological issues there in the vignette as well.
That is correct. And so now you just gave us a coming attraction of our next session when we practice some of these passages and bring everything together with the skills, because that links into testing strategies, you said. Once you understand the blueprint, you're like, okay, I can read a passage if I'm in the psychological, social, and biological foundations of behavior section. I can read the passage and know I may be looking for these three dimensions and appreciate that. But when I get to the individual questions, there could be 4 to 6 questions per passage, I will be able to then discern, are they focusing on one of the dimensions? Or do I need to integrate several of the dimensions? And for those who like to go back to the passage, you know how to go back to the passage with specificity. That's one strategy, going back to the passage. However, if we optimize our comprehension going through the passage because we understand the blueprint, we won't need to go back to the passage.
Right.
And that's the strategy I try to optimize for every scholar, to optimize your time. But more on that in the next FS. But since you went there, we had to give them a little bit of a good tease on now when you bring it all together. That was really good. Bring it all together with, okay, I got the blueprint. How do I execute when I'm now doing the actual passages? Well, let's go to the next section. That was good.
So the next section, I'm going to get my practice in here, which is cars, right? Which has nothing to do with driving, but the critical analysis and reasoning skills, right? And so this is maybe reading a passage on art history, and then, as we said, understanding what the argument is, analyzing what the logic of the writer is, and then being able to extrapolate, especially this non-science-based information, into answering the question correctly. And so this is a skill, obviously, we already talked about, that is very critical as a practicing physician, or when you go through your clerkships, future doctors, you'll have that opportunity when you get into the patient room. But being able to extrapolate this non-science information and putting it in a frame that makes sense to analyze what the data is saying and the logic of the author, and then extrapolate is something that is being tested in this cars. And from my understanding, cars has its own set of specific learning and thinking skills that it's also testing on.
That is correct. And so in our next section in a moment, we're going to review the actual thinking skills In the structural section that we're talking about right now, with respect to the critical analysis and reasoning skills, there are only those thinking skills that you just outlined, right? And we're going to go into more detail on those in our next segment in a moment. But to close out this segment in terms of structure, we want to appreciate that those three science sections, they have what are known as foundational concepts. And foundational concepts are areas of information that come together for a meaningful purpose to explain some area of human function. That's a big focus. And so, what guides the content review for the science sections are these foundational concepts. But the goal is not to memorize the content, but to now understand it and then go through this process of connecting it to a purpose in medicine, as we've illustrated in those three science sections.